1 in 8 women. It's not just a number. It's your sister, your mother, your best friend. Maybe it's you. When someone hears the word cancer, everything else goes silent. They don't hear treatment plans or options. They hear, how long do I have? Who will care for my children? How will I afford this? Breast cancer is more than a medical diagnosis. It's emotional, financial, deeply personal. That's why we're starting this conversation with compassion, clarity, and most of all, hope. Today, 2 expert voices help guide us through a journey no one asked to take. But no one should face this fight alone. Because awareness begins with listening, and it starts with stories just like yours.
Welcome to the Doctor Health Channel, a place where healthcare professionals from all fields come together to share expert insights, empowering you, your family, and your loved ones to make informed decisions about your health and well-being. This channel is for educational purposes only and is not a substitute for professional medical advice. I'm your host, and today we've got 2 incredible guests joining us, Dr. Lauren Ramsey, a breast surgeon, and Dr. Steve Mapula, a plastic surgeon, both practicing right here in the Dallas-Fort Worth area. Together, they'll walk us through everything you need to know about breast cancer, from diagnosis to treatment and the journey through reconstruction. So grab your coffee, get comfy, and let's dive in.
Okay, so Dr. Ramsey, we're here today. So we're talking about a topic that's very important, obviously, to both of us. So you're a breast cancer surgeon, I'm a plastic surgeon. So I want to get some insight from you about breast cancer. Give us a general overview about breast cancer. How common is it? What do women? What percentage of women have to worry about it? How do they get screened for it? And if they do have a suspicious screening exam, what do they do? Where do they go?
Yeah, that's a great question. I'm really happy to be here with you talking about this issue that, as you said, is important to both of us. So breast cancer is a common problem. The most recent statistics say that it affects about 1 in 8 women. So this is something that's affecting millions of women over the world. I feel like no matter who you talk to, they know someone who was affected by breast cancer,
Right.
is that their relative, a friend. And now we're actually seeing that there's a rise of breast cancer in women under the age of 40. So in younger women, and some people might be seeing that on social media, that there's these younger bloggers that are getting breast cancer. So it's really just kind of become a public health phenomenon, breast cancer. And that's kind of what drew me to being a breast cancer surgeon, because it's such a common problem. The causes of breast cancer, we're not really sure. It's definitely multifactorial. Obviously, genetics play a big role. So if someone has a strong family history of breast cancer, there's some genes that can run in families. And if you do have that family history, then it's important to get established with a doctor earlier so we can start screening you earlier. Other factors are like reproductive factors. So when you started your menstrual cycle, when you started menopause, how many times you've been pregnant, if you breastfed, all those things can factor in. Other things like obesity, your activity, hormone replacement can slightly increase your risk of breast cancer. So it's definitely multifactorial. And now we're even seeing some like environmental factors as well. There's some toxins that can be in our products that can kind of disrupt your hormones that can be causing this higher rate of breast cancer. For women that are concerned about breast cancer, we teach them that they need to do what's called breast self-awareness. And so this is basically doing your monthly exam at your home and basically feeling your breast, just knowing what your normal feels like, and just to make sure that you'll be aware then if there's any abnormal lumps or anything that come up. So I recommend patients do this like once a month, just so they're familiar with themselves and they're aware of their own breast. And then for women who are at average risk of breast cancer, we recommend getting your annual mammogram starting at the age of 40. So unless you have a higher risk of breast cancer because of a family history or something like that, we just recommend the annual screening mammogram starting at the age of 40. If for some reason you do get a call back that your mammogram's abnormal, you don't necessarily have to be alarmed and think that you have cancer right away. There are some other findings that we can see on mammograms that are not cancer, but usually they'll call you back, they might do some additional imaging, and then they'll do a biopsy. And if they do the biopsy and it shows that you have cancer, then they usually refer you to come see a breast surgeon, someone like me.
Yeah, it's so interesting that you talk about, the rise in incidence of breast cancer, or the, the number of people that are getting it before age 40. These are younger women now. Why is that, do you think? Is this a rise? Is this something regarding genetic abnormalities like the BRCA1 and 2 genes that we're seeing more of? Or is this, an environmental thing? Is it multifactorial? Why is this happening?
Yeah, I think it's multifactorial. We are noticed that girls are starting their menstrual cycles earlier. That's just a phenomenon that's been occurring that could be related to the rates of childhood obesity. So because of that, then those girls are seeing more estrogen over their lifetime. And the more estrogen that a woman's body sees, then it can actually increase the rate of breast cancer. Another thing is that women are starting to have children at later ages, and pregnancy actually reduces the risk of breast cancer because during pregnancy, another hormone takes over called progesterone. So since we are kind of delaying childbearing to maybe your later 30s, just because women are maybe doing other things in graduate school, having their careers, that could be another reason as well. But it's not clearly defined, but we just know that it's not just breast cancer, but other cancers are also rising in people under the age of 40.
So it sounds like what you're saying is that, it's really not just 40-year-olds that need to be doing self-breast exams. It's really women of all ages.
So I recommend that women kind of any age, I would say maybe around 30, in their early to late 30s, they start doing their breast exam. But really, it's never too early to begin, just so you're aware of what your normal feels like. So this way you're more aware if something feels abnormal.
Yeah. So, what about a young woman who has a little bit of pain in her breast with her cycles? Is that generally something that you need to worry about?
That's something normal. So I do think that a misconception is that breast pain is a symptom of cancer.
Yeah.
And sometimes it is, but usually it's not. So if you're getting breast pain or if you're feeling lumps maybe on both sides that come up, every 30 days with your cycle, that's probably just benign hormonal changes. The signs of breast cancer that I tell my patients are if you feel a mass, if you notice any skin changes, like your skin dimpling down, if you see any changes of your nipple, like your nipple pulling back, or if you notice any nipple discharge, especially if it's bloody. But pain necessarily isn't a sign of breast cancer. Sometimes it can be at a later stage, but usually it's those other things.
So if somebody feels a breast mass, for instance, where do they go? Do they call you directly? Where do they, what's the first step that they need to take?
I would say the first step is going to a doctor that they're already established with, like their primary care doctor or the OB/GYN. Usually women go to them first, and that physician can usually do an examination and order some imaging. So if they have a mass that they feel, then they would get something called a diagnostic mammogram. And this just looks at the breast a little more closely than the screening mammogram. And then after that, if they get a biopsy and it shows cancer, then they'll have a referral to a breast surgeon. But if a patient does have a mass, they're always welcome to find a breast surgeon as well, and we can always take care of them.
That wraps up today's episode. A heartfelt thank you to Dr. Ramsey and Dr. Mapula for sharing their insights and expertise on such a vital topic. You can find their practice details in the description below. If this conversation resonated with you or someone you care about, please share it. It just might make all the difference. And the best way to support this channel is to hit the subscribe button wherever you're watching. Until next time, stay informed, stay empowered, and stay healthy.